let's start. She's from an exam question. Below is a diagram of a certain tissue. Label the parts A to L. She's how it came, just like that. Let's start. What is A? What is A pointing at? You can't see the screen. It probably should be. It should be maybe your net. So check either your network or your bundles. One of those. I think others are able to see. Right, others? Okay. Excellent. So people have said mast cells. That is correct. Let's go to B. What is B? What is B? Anyone? Elastic fibers. Good. Can you see that those are branched fibers? And then let's go to C. So C is this other side. What is C? And you can't miss C, can you? What is C? Okay, those are reticular fibers. How about D? Anyone who can say what is D? Okay, I know you can. I'll come back to it. Let's go to E. What is E? Mm-hmm. Okay, someone has managed to answer D. I was expecting someone to fail. Okay, that's good. So the D is mesenchymal. Remember the chima cell that looks like a star? That's a mesenchymal cell. Okay. And then what is E? Okay, E is collagen. Very good. Okay, a very thick bundle. And then F. What is F? What is F? Mm-hmm. Anyone? F. Okay. So if someone says macrophage, is that true? If F is a macrophage, what will be I? Very good. So F is a fibroblast. And then FG. So what is G? G. Okay, so G is a fixed macrophage. I is a free macrophage. And then H. Anyone? What is H? H. So H, those are plasma. That's a plasma cell. Okay. And then J. Okay, good. And then J. What is J? Anyone? So J is not pointing at anything. So that's ground substance. Excellent. And then what is L? L. Adipocyte. Good. But just to be specific, that is white adipocyte, because a brown one would have had a lot of lipid droplet. And then what is K? Okay, you can see that K is a blood vessel, isn't it? Mucoid connective tissue is present in adult, is typical of umbilical cord, found in nostrils, typical of vaginal secretion. What can you pick there? Very good. So the answer is B, is typical of umbilical cord. Tendons are dense regular connective tissue, rich in elastic fiber, are rich in reticular fiber, has deficiency in collagen fiber. What can you pick there? Excellent memory. So it is a dense regular connective tissue. Next, the following are wandering cells of connective tissue except mast cells, basophils, eosinophils, neutrophils. So wandering cells, these are cells that are not fixed. Now we want a fixed cell. Okay, memory excellent again. Mast cells are cells of connective tissue. Mast cells, A, mast cells are epithelial, B, produce antibodies, C, phagocytic, D, produce SRA. Anyone? What can you pick? Phagocytic in nature? Unless macrophages. Macrophages are phagocytic, not mast cells. Next option. Next cell. Next next option. Okay. So remember the mast cells. Let me maybe ask, what do mast cells really contain? What do they contain? Is there anyone that is able to answer that? Okay. So A cannot be true, it's epithelial. B, produce antibodies. That cannot be true because you know the ones that produce antibodies, it's the plasma cells, phagocytic. These are not phagocytic unless macrophages, neutrophils. So what remains is D, even if you don't know what SRA is. So probably think of one of the granules. Plasma cells have eccentric nucleus, eccentrically placed nuclei, well-developed endoplasmic reticulum, phagocytic ability, basophilic cytoplasm. Which one can you pick for this one? Which one can you pick? I'll read again. Plasma cells have A, eccentrically placed nuclei, B, well-developed endoplasmic reticulum, C, phagocytic ability, D, basophilic cytoplasm. Any thought? Okay, our friend says basophilic cytoplasm. Mabel says basophilic cytoplasm. Memory says C, phagocytic ability. Okay, let's hear again. Anyone else? Okay, Lista says D again. Okay, anyone else? And then another one says C, another one says C. Okay, this is a nice one. Okay, so let's start with, so plasma cells produce antibodies. Okay, they produce antibodies. When you look at their nucleus, mm, their distinctive feature about the nucleus is that it is the biggest description about the nucleus of antibodies. I want the plasma cells. I want to show you that is that it is, look at the way it is cut in appearance, and besides that, where is it? It's at the end, so that is eccentric placed the nucleus. But when you look at the other feature that we have picked, where is that? Phagocytic ability. uh Plasma cells produce antibodies, they are not phagocytes. Okay, they are not phagocytes. Articular cartilage. Now we'll talk about this when we talk about cartilage. Fibroblasts, A, phagocytic, produce antibodies, synthesize collagen, are mature cells of connective tissue. Anyone that can pick an option here? What can you pick? Okay, so fibroblasts, they make collagen. Reticular fibers are readily seen with H&E stain, are gyrophilic, pass positive, contain elastin. What can you pick there? Any thought? Okay, someone picks B. Excellent. They are gyrophilic, isn't it? They can be stained with silver salts. Brown fat cells are unilocular, found in fetuses, under normal regulation, more abundant than white fat in adults. Which one can you pick there? Which one can you pick? Okay, they are found more in fetuses. Okay. Aponeurosis are found in central nervous system, found in the peripheral nervous system. Flattened sheets of dense, irregular connective tissue composed of collagenous bundles. Which one can you pick? Okay. C. C would have been correct, but it's not made up of dense, irregular, but dense, regular. So that what makes C not correct. Which other option are we able to pick? So it's made up of four collagenous bundles, all right? These collagen bundles. Collagen fibers are basophilic, acidophilic, metachromatic, bifringent. Which one can we pick? Now, collagen fibers stain red, so they can't be basophilic. Okay. And when you look at B, acidophilic, really not to say acidophilic. Metachromatic is a property for another cell, not collagen fibers. Okay. But these guys are bifringent, so they'll be able to. So bifringence just means a property where the things can reflect, or you call it reflect light. Most common type of connective tissue cell is mast cell, plasma cell, fibroblast, mesenchymal cell. Which one would you pick? So it's the fibroblast, isn't it? Cut appearance of nucleus is a feature of Macrophage, mast cell, plasma cell, pigment cell. So, very good, plasma cell. Metachromasia is a feature of mast cell, adipocyte, macrophage, mesenchymal cell. Which one can you pick? Metachromasia. Different staining properties is a feature of which one? Very good, option 1. The important feature of collagen fiber is branched, elastic, anastomose freely present in bundles. Which one can you pick? So it's present in bundles, right? The framework of spleen is made up of plasma cell, mesenchymal cell, elastic fiber, reticular fiber. Which one do you pick? Elastic fiber. Is that true? Elastic fiber. Is there anyone with another option? Okay, so remember reticular fiber. The matrix of hyaline cartilage contains capillaries, nerves, chondroitin sulfate, elastic fibers. The matrix. Okay, this is even about cartilage. But matrix should contain ground substance and protein fibers. Okay. And hyaline contains collagen and extracellular matrix, of course, chondroitin sulfate is going to be part. So that is going to be the answer.